Hello, my name is Anwar, and I'm here to persuade smokers to quit smoking and to tell the audience about the dangers of smoking. Did you know that smoking is the number one preventable cause of death in the United States? According to Cancer.org, there is 440,000 deaths a year caused by tobacco. On average, every smoker costs their employer almost $2,000 a year in labor lost. By the end of the speech, the audience will be informed about the dangers of smoking and persuade those who smoke to quit smoking. A smoker's point of view on smoking. Why do smokers smoke? According to Matthew Anderson, smokers smoke to relieve stress. It gives the smoker a rush after smoking a cigarette. He mainly smokes for socialization and relaxation purposes. Why don't smokers quit? Because they can't. It's too addicting. It gives him something to do when he is bored or driving. Smoking cigarette kills. Thousands of people die from smoking related diseases every year. Tobacco smoke contributes to a number of different types of cancer, including lung, throat, and mouth cancer. Smoking also causes you to have high blood pressure and increase the wear and tear on your heart. This can eventually cause heart attack and stroke. It slows your blood flow, cutting oxygen to your hands and feet. Some smokers end up having their limbs amputated. The strains put in your body by smoking can often cause tears of suffering and is a slow way to die. For example, emphysema is an illness that slowly rots your lungs. Not only does smoke kill, it can also make living very uncomfortable. According to the easy way to stop smoking, smoking kills the cilia in the lungs, the small hair linings, making it very hard for your body to combat cold and increases the amount of deoxygenation of the organs of the body, which will eventually lead to the death of the organs, which can be very dangerous. Smoking is not only bad for health, it also has a bad effect for the people around you. Breathing other people's smoke is called passive involuntary or secondhand smoke. The non-smoker breathes side stream smoke from the burning tip of the cigarette and mainstream smoke that has been inhaled and exhaled by the smoker. Secondhand smoke is a major source of indoor air pollution. Some of the immediate effects of passive smoking include eye irritation, headache, cough, sore throat, dizziness, and nausea. Adults with asthma can experience a significant decline in lung function when exposed. Tobacco smoke contains dangerous chemicals, which includes tar. This is the collective term for all the various particles suspended in tobacco smoke. Carbon monoxide, which is also another very dangerous odor gas, which is very fatal in large doses because it takes the place of oxygen in the blood. Each red blood cell contains a protein called hemoglobin. Oxygen molecules are transported around the body by binding to these hemoglobins, which carbon monoxide gets binded to when consumed in large quantities. Another gas is radioactive components, which are also known to be having carcinogens and dangerous other chemicals. Effects of smoking on respiratory system: irritation of the trachea, the windpipe, and larynx, voice box. Reducing lung function and breathlessness due to swelling and narrowing of the lung airways and excessive mucus in lung passage. Increased risk of lung infection and symptoms such as coughing and wheezing. Permanent damage to the air sacs of the lungs. Effect of smoking on the circulatory system: raised blood pressure and heart rate, less oxygen carried by the blood, and damage to the lining of the arteries, which is thought to be a contributing factor to arteriosclerosis and the fatal death caused by strokes. Effects of smoking on the immune system: the immune system doesn't function very well, and it takes very long for to heal for when a person gets sick. Other effects of smoking on the body includes increased risk of painful ulcers along the digestive tract, reduced ability to smell and taste, and also premature wrinkling of the skin. And not to mention the very dangerous effects of smoking on women, especially the pregnant women, which will also have a very dangerous and severe fatal effect on the newborn baby. What are the long-term diseases caused by smoking? Of course, as we know, lung cancer, mouth, nose, voice box, tongue cancers are one of the main reasons why people should stop smoking. Uh, really, why quitting can be very hard for some people. Managing unpleasant feelings such as stress, depression, loneliness, fear, and anxiety are some of the most common reasons why adults smoke. When you have a bad day, it seems like cigarettes are your only friend. Smoking can temporarily make feelings such as sadness, stress, depression, anxiety, and boredom evaporate into the thin air. Of course, this is wrong. As much comfort as cigarettes provide, though, it's important to remember that there are healthier and more effective ways to keep unpleasant feelings away. These may include exercising, meditating, using sensory relaxation strategies, and practicing simple breathing exercises. For many people, an important aspect of quitting smoking is to find alternative ways to handle these difficult feelings without smoking. Even when cigarettes are no longer a part of your life, the painful and unpleasant feelings that may have prompted you to smoke in the past will still remain. So it's worth spending some time thinking about the different ways, and to consult a physician to get on track to leave smoke and quit smoking for a better future and a better healthy living. I would recommend everyone to think about quitting smoking because it's very bad for the health, as suggested, and for the well-being of mankind. Thank you very much.